Thank you. Good morning. I think the day so far has been filled with lots of great information, even some things that I was not specifically aware of that are going on in the college, but it's really eye-opening. And I think if we take a minute to reflect on a lot of the topics, areas of research, expertise, a lot of it goes back to the concept around innovation and how do we create innovation and how do we use a process that's going to lead us into creating something new or different in a way that brings value. So out of curiosity, how many of you think, by a show of hands, that innovation needs to be an invention? Just by a show of hands. Sorry? It does need to be intentional, absolutely. But one of the things I find as I teach the introductory class in the master's program is that frequently a lot of the incoming students think of innovation as a thing or a product or a technology, which in many cases it is. However, it really is about taking a process or an object or an idea and creating something different with it. In fact, if we think about a lot of the innovations throughout time, many of them are modifications of things that already exist, but using it in a different way. And as I was thinking about the talk yesterday, I almost thought, I really want to get away from talking about change per se, because, change has a bad rap. A lot of people don't really like that name, that word, for a variety of reasons. And really, I think in our roles, especially as leaders, whether we're in an operational setting, if we're in an academic setting, our role as a leader is to help create the transformation frequently after the change actually takes place. So there's a change theorist, William Bridges, who has more really of a psychology background, but he divided change up into 3 distinct phases that were really about transitions. So change in and of itself is something that just happens. So how many of you have actually worked for an organization or been a part of a team, and we all get geared up and there's a lot of work around creating change or implementing the change, and it kind of comes from high above. It's either an organizational mandate, or we have to change this software, or we have to change this process. And frequently in that situation, you're not really leading the change per se, the change has happened, but now as leaders, we're transforming what has happened and figuring out the best way to take whatever it is that we're being asked to do, or whatever it is that we're thinking about doing as a potential innovation or a transformation on design or a process, and making it something different. And frequently, it really starts with thinking differently. Innovation in and of itself is not a special and unique skill. It involves thinking and having ideas. It involves the idea around being creative and just thinking about doing things differently. If I recall, it was about 24 years ago, and it was my first major change process. I was a newly minted director over a clinical operations area, 4 intensive care units, and the staff started to identify that our post-operative open heart patients were developing sternal wound infections. And while this unfortunately was not a new problem, we saw a huge spike in it. And it was through the nurses at the bedside, the direct caregivers, that they identified this issue, brought it to me. I mean, we had seen the objective data that had been presented in, patient safety and quality committees, but they were the ones who really started to identify the trend even beforehand. And then because of that, we launched a number of groups that started to ideate. They started to think about what the problem was. They started to do different tests of change. And they ended up coming up with several different strategies that actually changed, prevented, and actually saved the lives of many patients. And we went from a sternal wound infection rate of almost 60% with that patient population at that time to 0 in a matter of like 60 days. And it was through just different thinking, and some of it actually, in the end, ended up changing some of the therapeutics as it related to, these were the early days about looking at, blood sugar levels and how hypoglycemia or hyperglycemia could accentuate infection, et cetera. So if we really think back of it, I don't know 24 years ago if I was actually thinking about it in a deliberate way or thinking about it differently. It was almost organic. And frequently with innovation, it is more organic. And this is the Stanford design process. It's really the heart of a lot of innovation thought and design thinking. And there's many other different models that include that, or their modifications. One of the things I ask students to do in class is to find a design model that they like, and then talk about why they like it and how they would use it. And I also give them the opportunity, if you want to take two models and combine them, if you want to create your own model, go ahead and do it. Think about how you would take what we know and then modify it, create your innovation with it. So take an idea and create something for value. And value is driven by whoever's going to use it, the end user. So in my example about sternal wound infections, again, it was not engineered this way, but in retrospect, the process and the change that we actually affected had a direct impact on patients, what the nurses did, how the physicians were doing things, and ultimately families and the entire patient population that was having open heart at that time. So it really did have a lot of effect on the end users at all different levels with those stakeholders. And we get to that by the very first step, which is really empathizing and understanding. What's the need? Why do we want to do this? Have we defined or seen something in our work, in our practice, that we want to do differently? And then we begin the fun part. The part that everybody likes is the ideation. So we get together and we brainstorm and we think about all these different ideas of how we could identify solutions, because we all love to jump to solutions first, right? It's always fire, ready, aim, as opposed to sometimes thinking about, okay, so why is this happening? What do we need to do? Then we may need to go to a prototype, whether it's a prototype around a process or it's a prototype around a design for something. I could kick myself. I was working in the emergency department in the late 80s, kind of at the height and beginning of the HIV/AIDS crisis. And of course, everybody was looking at, how can we create barriers? How can we create more safety for healthcare workers? How do we reduce transmission? And I often thought about, when you start an IV, and especially in the emergency department, since it's something you're doing quite frequently, as you start the IV and withdraw the cannula, or the cannula, I always thought there needs to be like a one-way valve in there, so that when you pull it out, that the blood doesn't come, if you're not putting enough pressure on it, that the blood doesn't come shooting out. And lo and behold, there have been all kinds of modifications to IV catheters that do similar types of things. I could be a rich man and not here right now, but I am here. So it's some of those. I am very rich, both emotionally as well as intellectually, by my role. So those prototypes or ideas that we want to try, we can create in the lab. It might be something that we do with 3D printing. It can be taking bits and pieces of something and putting it together into something new. We're working with an organization that wants to transform some different pieces of hardware that they've been using in the patient care space, with like the computers on wheels and the workstations on wheels, and identify how could we make something better out of this, and all the bits and pieces of that. So we're anxious to start that process because we think it'll really kind of yield some fun things. And then once we start to prototype, test, refine, then we really get to that implementation phase where we take those ideas after multiple, generally, iterations. And sometimes what you start with or the question you have changes, just like in research. You may start off with a general hypothesis or research question, but as you go about it, it may start to change or morph to become more specific or to take a different approach to the idea. And then once we start to implement, pilot, we can then begin to assess the outcomes and the evaluation of what is the value? Are we really seeing the value that we hoped to get out of it to really complete the definition of innovation? Are we innovating? Are we creating value? And then as you can see, it is really very much this iterative process of going back and forth. And while we want to create value, sometimes there's unrealized value that we haven't captured yet, as well as unintended consequences. We may use something and think it's doing great for what we wanted, but then we realize as we look at it, maybe it's causing other issues, and we might need to kind of go back to the drawing board or refocus the work. So just kind of as a summary, for many of you, I know many of you are in healthcare, both on the acute care space, academia, community partnerships, community health centers. Utilization of evidence-based practice and the actual innovation design process are extremely similar. Now, there are a couple extra steps in evidence-based practice. However, if you really look at these, they follow very much a pattern. And they both end up with wanting to, for the EBP, disseminate the outcomes of the work after we've done evaluation. But also then on the innovation and design thinking side, we're creating that value and scale for something that we are going to implement. So whether it's a new software for an app or a new device that we're going to use, if you think back even 10 years ago with wearables, and you think about where wearables started and where they are now, and potentially where they're even going to go in the future, or how we've adapted different things like a drone that we now use for non-military purposes and other types of deliveries, etc. It all changes over time based on somebody's thought or need. And again, if we go back to that process, what was the question? What are we trying to solve? And how can we do it? And what's the better way to do it? So just as a wrap up, I know that, again, change can be a dirty word, but it's really that transformation that we as leaders or academics have the opportunity translationally or actually in the field where we're doing the work to actually bring something new and different to create value for those stakeholders. So thank you very much.